Greetings, everybody. 46 years of professionally dealing in holistic health, I checked most of those boxes of doing the right thing, but I left one that was marginally unchecked. The connection between my oral health, the gums, the teeth, and cognitive ability and heart health, plus many others. I thought I was doing things right, but because I was given an assignment of let's discuss this topic because it's getting more and more popular regarding gum health and body health, I took a deep dive of many hours of accessing information from those trusted individuals, the dentist, Huberman, many, maybe 6 or 7 other experts in the field of functional health, dentistry health, nutritional health, and I plugged it all in order to help everybody to help themselves. But it was very personal to me because the more I learned, the more I realized how little I actually knew about this subject. So really and truly, what are we going to talk about today? We're going to talk about oral health being the missing link in my health journey, big time, and maybe in yours. Because it's not just about nice looking teeth. It's not just about do my gums bleed or the dentist says you need better health, better gum tissues or better health in the gum area. It's about the connection between the things that go on right here and your cognitive decline, the cardiac disease risk. 80% of us are going to die from cardiac reasons. A lot of other issues going on in life, but 80% will pass away because of a stroke, a heart attack, or anything related to that. So we now know that the gum and teeth health or lack of is significantly impacting that issue. But how about the other ones? Blood flow issues. A lot of people can't heal very well because the capillaries are damaged as we age, and then we don't get enough blood flow in and out. Eye health. Eyes are so fed with blood that if it gets decreased, you will have less health in the eyes. Diabetes. Immune function. Well, I'll explain that a little bit later, why that happens. Pregnancy complications. This was something I had no idea about. How many people, women in this country may have suffered with pregnancy complications, and no one has a discussion of, have we checked your gums? Have we checked things within the mouth to see if you are resilient, strong, and stable enough to have a healthy pregnancy? I'd say almost no one. Lung health, blood pressure. It's a huge one. In fact, before I even get any further down the list, this product was invented in 1873, and it has very strong evidence that it's raising blood pressure in people, and I'm going to explain the mechanism of how this is happening. It was shocking to me, absolutely shocking. Erectile dysfunction, back to the blood flow issue. And far overlooked is the aspect of the gum health and microflora within the mouth that's affecting psychological issues within epidemic proportions in this country of anxiety, depression, and other issues. How many psychiatrists do you think actually require an evaluation of teeth and gums when someone's struggling? I would say 0 at this time, but I am predicting that will be a turn over the next few years that will be accepted somewhere probably 10 to 15 more years. You don't have to wait that long. You can do it on your own now. And last, completely oblivious of this, I've seen so many people who have wake up with AFib one day. And these are healthy individuals often, good athletes and people who take good care of themselves. And AFib can be very dangerous because it can throw a blood clot, and a lot of people have to be on blood thinners. Well, I had no idea the connection between the mouth, the gums, the microflora within the gums, and AFib. So actually, a little bit of information here. Why do we get tooth decay? We get tooth decay for a couple reasons. And if you think about going down many times on the road, you're driving your car, and you see that big hole in the ground, the concrete, that your car, you don't want to get the tire in because it's deep. Well, that is kind of how the enamel and dentin of the teeth start drilling holes. The bacteria does, basically called Staphylococcus mutans. And what happens is these bacteria overburden the mouth due to multiple reasons we'll talk about that we can control very inexpensively. And that creates an acidic environment, and any food that has carbohydrates in it will then allow this staph mutans to actually go into this corrosiveness within the tooth itself. And what I really was exciting to learn, and I really doubted it at first, but we can rebuild the enamel on our teeth up to a point. And that point is, of course, like the pothole in the road, if it gets way too deep, they have to dig a whole bunch more out and block the road. But if it's moderately small, then they can just pour concrete in it. Well, that's the same thing we can do with a couple practices that I've learned from all these experts. And I'm going to explain that in just a minute or two. Now, I want to deal with something called the nitric oxide story. Nitric oxide was actually the researchers who found this, and it's a natural process of our body, was awarded the Nobel Prize for Medicine several decades ago. That's how important this molecule is. And again, the wake-up call for me is that nitric oxide, which is involved in producing a relaxation of blood flow. When you don't have enough nitric oxide, men will have more erectile dysfunction. People will have far less blood flow to all the extremities, and healing will be slowed, all the things we don't want. And what produces a big chunk of that is the microflora within the mouth. That is something that I know all about the microflora from the throat to the end of the colon because I studied that for the past 30 or 40 years. Looked at tons of stool tests, done my own research on my own body about what do I have, what do I need, how do I fix it. But I never even considered the impact of microflora within the mouth. We have microflora that's different under our arms. Women have microflora of the breast. We have microflora of the skin. So we have all these different microflora. What are they? They actually are companions on this ride through life. If you think of a huge family, you have, not all family members are probably going to get along very well. But if you have the majority of them, there's far less drama and far less problems within the unit of that big family. Well, what we try to achieve is that most of our microflora is of the friendly version. We can't have all friendly, it's just the way the world works. But we don't want those Staphylococcus mutans, and we don't want the E. coli's, and we don't want these other ones to be the predominant and dominant microflora. Because when that happens, our team, our support system is compromised significantly. So when you do things to destroy the microflora within the gums and the mouth, you are really doing a disservice to the good bacteria, and it seems unfair, but that the negative bacteria want to grow back faster. Especially if you've been on a diet of processed foods or sugars, and eating and not brushing right, which I'm going to talk about, not flossing correctly, not using things like xylitol, which is miraculous. So if you don't do the right things, the family members who are trouble and are drama are going to supply what you have within the mouth. When that happens, tooth decay is going to increase significantly. But some of these microflora are there to do other things like produce nitric oxide. I talked about just a second when we first started about Listerine. Listerine is an 1873 product, still recommended by many dentists, certainly advertised heavily, and all of its other type of mouthwashes that contain these strong alcohols. What that's doing is devastating the microflora. You can look up on AI or look up wherever you want, but there's a good correlation between using these things regularly and destroying the ability of your body to produce nitric oxide. Yeah, it feels like, wow, I just cleaned my mouth like I've never had it because it kind of burns and it kind of feels antiseptic and things. That's not what we want. We want a friendly environment that doesn't keep getting attacked. So first piece of advice, don't ever use anything regularly that's going to kill across the board like a nuclear bomb within our mouth. Listerine's one of 100 at the drugstore, grocery store. So We want to create a great microbiome. There's no doubt. We have to do that. And in order to do that, we have to understand the implications, like how your oral microbiome influences your risk for dementia. There's a certain bacteria in the mouth called P. gingivitis, and what that does is when they tested the brains of Alzheimer's patients, 97% had this certain bug, we'll call it, in the brain. 0% of the people with normal brains did not have it. Because we're dealing with a system here that's very close to the blood-brain barrier, and it would be far more difficult for something in the abdomen to penetrate the brain. But when it's sitting right next to it, with the amount of blood flow that's here and the inflammation that may be in the mouth, it's pretty darn easy. So we have to be cautious about that. And how about the fact that heart disease and stroke are increased? Well, nitric oxide is correlated, low levels, to both of these conditions. So one of our goals is to produce more nitric oxide by not killing the microflora. So I'm totally against anything that's what we call antiseptic in regard to all of the bacteria. Now, I am a fan of oil pulling, and some of the products with oil pulling have a few herbs in it. I'm not a fan of regularly using those, but I think once a week or twice a week at most, doing the oil pulling. And what is oil pulling? Oil pulling is using an oil. It's an ancient process and remedy. I mean, many hundreds of years. And you put it in your mouth and you're going to swish. And it is a little bit of work, let me tell you. You're going to swish for about 20 minutes. Not hard swishing, but swishing to the point where you are mixing all of the oil within the gums and the teeth. What that's doing is, one, if you've ever heard the word biofilm, what a biofilm is, and I was a police officer in Chattanooga back in 1979, I wore a bulletproof vest. Well, a bulletproof vest helped to protect me from something that would be attacking me. Well, biofilms actually are what bad bacteria use as their own bulletproof vest to protect them from your immune system. So we don't want too much of this biofilm. We want to allow the body to control its own systems. So using coconut oil or other, like I met a gentleman at one of the conventions, a beautiful family that makes this oil pulling elixir, and it's an Indian formula, Ayurvedic formula. I like doing this about once, no more than twice a week. But any oils can work. I do prefer good quality coconut oil. That way the body gets more exposed to the ability of the body to control that good bacteria. Now, what do I do, or what do I think I should do about replacing that good bacteria? Because we know, I think most of us watching this understand the need for the good bacteria in the gut. How do we replace that? Well, we realize that taking antibiotics all the time are going to kill it. Doing things, chlorinated water, fluorine in water, which we'll talk a little bit about fluoride, are going to diminish some of those bacteria. Glyphosate, which is in many of our foods. So we have to try to do something to balance that. But you know what? I've always assumed, and I think correctly, that when I swallow those pills of probiotics, and I know this sounds childish, but I don't think they're going to crawl up my whole intestines and my esophagus, my throat, and then impregnate my gums. No. So what do we do about that? One is cultured fermented foods. Things like good cabbage, like we sell at Nutrition World, that actually have the good bacteria that nature allowed to be in there. Kefir, or kefir, as some people pronounce it, that is made with low sugar, not the ones that taste like milkshakes. Those are not going to be very conducive to your health. But one of the biggest pluses that I have realized in research is Life Extension makes it's called an oral hygiene probiotic. This is 2 different probiotics that have been shown, like here, daily intake of Lactobacillus plantarum, right here, can decrease the depth of pockets in patients that are having gum problems. So it's rebuilding that from the standpoint of replacing the good bacteria. Secondly, the other probiotic in here, Streptococcus salivarius, subgroup exhibited reduced Staphylococcus mutans counts. That's what we're trying to reduce, is the number one reason for us to have cavities and a lot of gum disease. So eating fermented foods, taking Life Extension Oral Hygiene. It's a pill that will dissolve in your mouth. That's why it's going to be put in the mouth. I certainly would do that after all oil pulling, and I would do it every single day. Plan on doing that the rest of my life. Now, you can get an oral microflora test to see exactly which one of these type of bugs, what percentage good, bad, neutral. We offer it through one of our coaches here at Nutrition World, or there is actually an online test called Viome.com, Viome.com. They're about $220. I think Nutrition World has a secondary test that's equal or better. That's about $189 at this point. But if you want to get fully tested, then that certainly is available. That wasn't even available a few years ago. I know I've heard stories as I was deep diving into this about people that had rheumatoid arthritis who got this test done, which showed what do we really need to do and is what we're doing working by retesting. And many of the stories, which doesn't prove anything, but many of those stories were offering vast improvement on their autoimmune diseases by putting the good bacteria back in. Now, can we rebuild enamel on teeth? Yes, we can. Let me tell you, as long as that hole's not too deep. How does fluoride work? I'm going to bounce into that subject. Fluoride works by concentrating a type of calcium called hydroxyapatite. That is what the enamel uses to create extremely tight angled bonds, almost like steel girders that are supporting a huge bridge. Well, fluoride actually forces the hydroxyapatite into these parts of the enamel that create a much stronger bond. It does, there's no doubt. Now, I don't feel that it's healthy in other ways because of its correlation, not proof, but there's very few things totally proven in this world. So we have to go with the wisdom part of this, is lowering the IQ of children and adults, and also dysfunctional thyroid. In 46 years, I've never seen more, especially women, who have a dysfunctional thyroid. What's going on? I don't know, but this could be part of that problem. But giving fluoride in anything other than minuscule amounts to children, it's just not a wise thing. I would always bet on what I call the ancient wisdom. And that ancient wisdom says it served me well that I'm going to give a chemical that actually forces a hydroxyapatite into enamel that under a microscope looks vastly different than when the tooth naturally does it. Guess what? This was not available until a few years ago. There are now toothpaste like Risewell is a brand that I really like that has as one of its main ingredients hydroxyapatite. So hydroxyapatite, you're just giving your body what it needs to take care of its own problems and issues rather than forcing it. Rarely do I see that forcing a mechanism in the body long term will do anything but more negative than positive eventually. Now, sometimes quickly that does positive, but it ends up biting us after a period of time. So, your kids, they make that for children too. If they are suffering with a little bit of decay and this and that, don't let anyone tell you, oh, we have to drill immediately. Give it a chance. Do hydroxyapatite twice a day and see what happens. Now, talking about tooth care, here's what I've learned, some more bullet points that I'm going to embrace. One is, talking again, we go back to the microflora, which almost no one probably will be discussing with you that's in the profession, but maybe that's starting to change. If we're talking about bacteria, we know that if you were using a washcloth, let's say in the shower, like a lot of people in the older days would use a washcloth and soap, what do you think would happen if you took that washcloth every single day after scrubbing yourself and you just put it there next to the shower every day for 2 weeks, 4 weeks, 6 weeks, you use the same one? You wouldn't do that. We need to trade toothbrushes in every 2 weeks, the studies show, because we keep inoculating ourselves with newer bacteria. And how about the bacteria that grows on the toothbrush? I have never been a good person to do that. I always thought when I see it starting to wear is when I get a new one. Well, that isn't common sense. And so it's good to buy bulk toothbrushes And the second thing about the toothbrush, it has to be the softest you can get. Again, one of the things I always believed in was like, if I'm going to clean the wheels of my tires or my car back in the day when I did that, I would get a brush and we'd brush it to get it clean, because the harder I brushed, the cleaner it got. Well, guess what? That doesn't really work in our favor with teeth. We just need to remove the particles of food that have somewhere lodged into any of those pockets, the outside or the backside, anything that is touching your teeth with a type of carbohydrate, mainly, then we need to remove that. And so doing that with a soft brush is far better. It doesn't hurt the gums, because we don't want to cause damage to the gums, and we need to brush those gums as pretty darn well, because that increases the blood flow. I didn't realize that gums have lymph systems in them. Lymph is what moves bacteria in and out and helps to create detoxification. And we don't really get that we don't get gum massages, but we can do it with a soft toothbrush. Flossing, extremely important, extremely. There's actually, Roswell makes a floss that has hydroxyapatite in it for those who want to get that in between the teeth. But one of the things, there's a company called Mamavation who test different products, from shampoos to all kind of some foods and things that you don't normally get tested for negative ingredients, heavy metals, plastics. And they found that one of the Oral-B flosses contained more of these, what we call forever chemicals, than any one of the 40 flosses they tested. So I'm really encouraging you to buy flosses that do not have those type of products. This is the one I'm using, Dr. Tung's Smart Floss. Really like that. We certainly offer it at Nutrition World, because I don't want to gain 2 steps up and then 2 steps back. I want this to be as positive as possible. So using floss that doesn't have it. And then on the toothbrush, microplastics. What is that? Well, it's invisible to the eye, a type of plastic that is found in a lot of drinking water bottles. I actually tested my body for microplastics about 3 months ago. And I was in better shape than 3/4 of the other people, and I was in worse shape than 1/4 of the other people that were tested in the numbers. But supposedly we have the equivalent of a credit card size amount of plastics every few weeks that we ingest. Cardiologists have now, when they did analysis on plaque, are finding microplastics within the plaque. We know that it's totally unhealthy. Who knows if it's getting to the brain? I did not see information on that, but it might make sense because microplastics are so small. So the flossing correctly, the toothbrush replacing, using the right toothpaste is very important. Not using mouthwashes that have real antiseptics in it. Maybe once in a blue moon to kind of clean the slate, but other than that, we want to keep improving the microbiome by the fermented foods, the Life Extension oral dissolvable pill. Those are extremely important. Now, here's the 3-cent, as I wrote here, 3-cent miracle for your gum and teeth health. When I say gum and teeth, that involves everything. What have I been doing? The one thing I've been doing right that wasn't even spoke about when I started, which was probably 15 years ago, is mouth taping. Mouth taping, yes. I did a podcast on The Holistic Navigator. If you put in that on Google with the word breath or breathing, you'll hear my 40-minute of information on this physician in Russia named Dr. Buteyko, who talked about the devastation of mouth breathing. And I'm going to do it from not all the other aspects, from the oral dental aspect. Saliva is our best friend. When we lack it, staph mutans is going to flourish. If there's any particles on your teeth, the drier your mouth is, the more you're going to result in more of these negative bacterias, and that results in going down this list again. Everybody may be different, but all of those bacteria that causes degradation of our health of the microflora here is going to increase these. So we have to be very diligent about that. Now, dry mouth at night does two things. It feeds the staph mutans, but it also does something that is counterintuitive when we don't know better, which is we all think oxygen is the elixir. It's not. Carbon dioxide is equally important. And when you mouth breathe, what happens, and in most individuals, is your carbon dioxide decreases. Why do we want more of that? We don't if we're running fast races or I'm on the treadmill. But if I'm sleeping and I'm resting, I want it because it relaxes my physiology, my body, my blood pressure, my mental state. Slower breathing, ideal breathing's 8 times a minute. I don't think I know anybody who is that calm. But if you can breathe less, you're going to have more carbon dioxide. When you mouth breathe at night, you're getting almost no carbon dioxide. That's many times the reason why we can't sleep, because you are activating the brain with more oxygen and not enough of the relaxant molecule, which is carbon dioxide. Now, many different tapes I have used. This one called Sleepy Owl is on our website, nutritionw.com, and it's a fairly big piece. Do not get worried that you're going to be claustrophobic. The most anyone's ever taken is 3 nights to get used to this. And once you do, you will be, I think, pleasantly amazed. And I use an Aura ring to monitor my REM deep oxygen pulse. And you can buy these at Best Buys or straight from Aura, O-U-R-A. And they will tell you the truth. If you can see your numbers without tape and see your numbers with tape, you will see generally a trend toward better REM and deep and less pulse rate. So I'm highly encouraging sleep taping for keeping the saliva moist and also increasing carbon dioxide. Now, I'm not going to speak much on fluoride, but fluoride is very concerning to me, especially for children. I am a huge fan of not using it. I probably never use tap water unless it's an emergency. I don't use a toothpaste with it and haven't for 45 years. I've never had a cavity in 45 years. So it doesn't prove anything, but I just don't think we should be choosing fluoride. Now, as far as my pillars of health, this whole deep dive into the conversation of gum and teeth health actually made me add another pillar, because exercise, and not in exact order, but I think exercise is one of the top most important things we do. Why? Because strength levels as we age is the best metric for how long we will live. And if not how long we will live, it certainly is the best metric for the quality of life we will lead. We're losing 2% muscle most times after 40 years old. It doesn't take but a decade. Just you don't really see it because it's kind of like watching your hair grow. You're not going to see it overnight. But then all of a sudden, you start getting weaker of carrying the suitcase at the airport. Maybe the grandkids get more winded, and you just tell that you're not where you were when you were 30. That can be almost stopped by weight training and doing 1 gram of protein per pound of body weight. I'm a big fan of whey protein for myself, but I also eat a lot of protein foods. I believe in the healthy eggs like we carry at Nutrition World from local farmers, clean meats and cheeses and colored vegetables and healthy fat. And I do believe in this much protein a day, this much healthy fat, and this many carbs 6 days a week. On 7th day, more carbs. Sleep. Again, we go back to the sleep issue. I encourage you to look, if you want, read my book, which is if you Google nutritionw.com or Nutrition World sleep ebook, it'll pop up. It's a free ebook, and I have dealt with insomnia for decades. I feel like I know exactly what you are feeling if you have that. Knife and fork wisdom. I always say the knife and fork is still the most powerful weapon on our path to optimal health, and that means choosing the best foods we can, and really it comes down to not choosing certain categories. One of those is called seed oils. Seed oils are canolas and safflowers and vegetable oils. Those are devastating to all parts of the body because it affects the mitochondria, which is the basic cellular structure that produces energy. Every cell has it, so it affects the oral gum tissues also. So olive oil, real butter, hopefully organic, tallow, cook eggs in tallow, which is beef fat. If you just can't get comfortable with that, then just use butter. That's perfectly fine. And then nutrient supplementation. I take a lot of supplements. Nobody needs to take what I take, but we have to do something, and I called it a core 4. The right multivitamin, the right magnesium, the right vitamin D, and the right omega-3 fatty acids. Those will support you. I know it for a fact because I see so many people with blood work before they do it and after, and a lot of markers improve significantly just from doing the core 4. And then last is creating the oral health plan. That is a shift in how you think of how you're going to operate yourself morning and night. The nighttime oral care is, from the experts that I've listened to, are vastly more important than the morning. If you had to only do one, you've got to do it in the evening. Why is that? Because that's when the saliva dries. The saliva is somewhat protectant of your whole oral microbiome, but at night it doesn't have any protection. I love the dentist on Instagram named Ask Your Dentist. Dr. Bohina, I think is how you pronounce his name. Unbelievable for information. So access that. It will be in our show notes. And there are other toothpastes that are excellent besides these Roswells that don't have hydroxyapatite. I'm firstly concerned with being clean. Like the Himalayan here doesn't have hydroxyapatite, but it has clean ingredients. No fluoride, no sodium lauryl sulfates, no carrageenan, all of those things. And then lastly, xylitol. Xylitol gum is a miracle. Why do I say that? Because every time you eat, doesn't matter how healthy we eat, we're going to deposit particles within our system up here that will feed the Staphylococcus mutans. Well, you're going to have a buildup of more degeneration within the enamel if it stays there more than a few minutes. Well, guess what? Xylitol, which is a non-nutritive sweetener, the staph will ingest it like it's food, but it doesn't give them any fuel. What does that mean? They think they're going to get full, and they may feel full, but they kind of get weak because of no nutritional value in it. It is the coolest ingredient. Do we want to ingest large amounts in drinks? No, not particularly. We don't. These are tiny amounts. We prefer the brand Pure, P-U-R, because it's made in Sweden, I believe, and it's not Chinese versions of xylitol. Not that we don't trust a lot of things from there, but they couldn't give us the guarantees of purity that we got from PUR. So after every meal, if you can chew a xylitol, this little fella right there, staph mutans, will basically go to sleep. And so it won't have any interaction at that moment. So that's another to add to the plan. For those who have really, really terrible gums and they're trying to rehabilitate, I'm a fan of coenzyme Q10, that you chomp down on the capsule, let the coenzyme Q10 come out of the capsule, and just kind of with your tongue or your finger, you can move it onto the gums. It has good research to show if you're really in bad shape, do that in order to help the rebuilding process. So we've covered a whole lot of information today. I am 100% sold on a new plan of action for Edward Jones at almost 68 years old to try to make it to 78, maybe 88. And part of that's got to be this oral microbiome, because I'm worked so hard on this part and haven't done hardly anything up here. And when we do things like, people do things like vaping and smoking and strong alcoholic beverages, cigarette smoking especially, they're drying those saliva out again. So again, cleaning up our act one step at a time, and then creating the plan of action with the toothbrushing and the flossing and the right mouthwash, which doesn't have antiseptics if you want it, a little bit of oil pulling, the right ingredients of all of these things, and adding an oral probiotic in the mouth, eating fermented foods. It sounds like a lot, but it's really not when you get the plan. So when you know better, we can do better if we choose to do better. So there's your plan for the next 10 years. Make me proud. Thank you.